Well, June is PTSD Awareness Month, and it's really a reminder that post-traumatic stress disorder can affect anyone who's lived through or witnessed any sort of traumatic event. And this includes things like a serious crash, violence, a natural disaster, or even a medical emergency. So joining us now this morning is Dr. Kirsten Holmes, a licensed marriage and family therapist with the Harris Center for Mental Health and IDD. Welcome, Dr. Holmes. Thank you for joining us this morning.
Thank you. Thank you for having me.
Let's start with the basics. What exactly is PTSD and how can it affect everybody?
So PTSD is a post-traumatic stress disorder, and it does affect millions of Americans each year. This has to do when we witness or experience a traumatic event. That can be due to violence, to a weather event, to a medical emergency. It's most often associated with our first responders and veteran community, but anyone is subject to experiencing post-traumatic stress disorder.
How do you know if you are someone who is experiencing that? We live in a highly stressful life. A lot of us have had difficult things happen to us. Like, how do we know that this is what we're experiencing?
Like you said, we all experience stress, and it can be difficult to know, how is this regular stress or is this post-traumatic stress?
Or am I just used to feeling this way?
Right, is this my normal? But when stress affects your life to the degree that it's impacted my daily living activities, maybe I'm avoiding certain places, maybe I'm experiencing symptoms in my body and it's following a traumatic event. And it doesn't have to be even right after a traumatic event. It can be months, years later.
There's a delayed traumatic
yes.
feeling as well.
Yes, and so we have this feeling of hypervigilance, always on edge, waiting for the next bad thing to happen.
Okay, so at what point should we get help? How do we know we need help?
Sure. So here at the Harris Center, we treat folks every day that experience post-traumatic stress disorder. We help to manage those symptoms. Most of the time your family might notice before you realize it. Maybe you're irritable, maybe you're having flashbacks or nightmares, or you wake up in a panic, you're driving somewhere and all of a sudden you just get this wave of anxiety and you're not sure where that comes from. Those can be signs and symptoms that you're experiencing post-traumatic stress. And seeking help, finding a qualified therapist, someone to help you walk through those is really helpful to process that trauma. Sometimes medication can be part of that treatment to kind of tone down those symptoms just a little bit, but everybody is an individual in how they're treated, but it is treatable.
What type of treatments other than medication?
Sure, so I personally love narrative therapy, which says that we're the author of our own story. So just like a story, you're gonna have some highs and lows, some difficult chapters, but you get to decide, what's my response to that? How do I take this part of my journey, incorporate it into my life, and then use it positively going in a different direction?
What does recovery look like with this? Are you able to recover from this? How long does it take? Does it depend on the trauma and how long it's been? Just give me an idea of recovery and to give hope to people.
Sure, it's very personalized. So what I love about treatment for PTSD is it's a very personalized treatment. You work with a qualified therapist who's gonna know you, your history, what you've been through. If you've had compound traumas, which is multiple traumas over time, oftentimes what our first responders and veterans experience, that takes time to sort through and unpack. So going through those things one by one, it can take months, it can take years, but oftentimes finding with that support system, plugging into someone that connects with you, understanding how I live with this can help us to manage and live better lives.
What would you say to people who feel shame confronting any sort of a trauma that they've experienced? Because it is not easy to sit and speak of this trauma because it is so damaging. You know, it can be emotionally, even lead to physical damage. What would you say to people that it's time to really face it and to move forward?
You know, the best place to have a breakdown is with someone that you trust. And so getting in with a therapist that you trust, again, at the Harris Center, we provide counseling, case management, and support and services for folks. It's a non-judgmental, judgment-free zone. And it can be intimidating to walk into that therapy office for the first time. But when you sit down and really understand that someone's not there to judge you, they're there to listen and walk alongside of you through this pain and through this process, it becomes easier to set that shame aside because you're one of many, many millions of people that experience this.
Yeah, I didn't start therapy till I was in my 40s, and I wish that I would have done it before because there's just so much stigma around it, right? I had to break through that. And it's probably one of the best things that for sure I had ever experienced. And I tell people all the time, like, just do it, just try it. If you don't like it, back out, but
You got to
attempt it.
You have to get that person you're comfortable with. And I always say, before a crisis hits, that's when you need to know who to trust.
Exactly.
Don't wait until.
And it may take a couple
happens.
people before you find your person. So,
Absolutely.
Dr. Kristen Holmes with the Harris Center, thank you so much for joining us this morning.